Not to be overlooked, dental health plays a big role in children's lives more than you might know. Children with poor oral health may miss school and may perform poorly. In the Philippines, around 85% of children aged 5 and up experience tooth decay. This National Children's Dental Health Month, we take a look at how we could help kids keep their gleaming smiles and their overall health as well. The doctor is in this morning. Dr. Tala Dolatre-Turner joins us live in the studio. It's a beautiful day, Doc Tala. Good morning. Welcome to the show.
Good morning, everybody. So it's nice to be here in your show to promote like the children's oral health.
Yes, with big smiles,
Yes.
of course. Now, the number is big, Doc Tala,
Yes.
no? And I don't think that people are aware that this is a growing problem. But 85% of Filipino children are said to have tooth decay. That's a big prevalence compared to global averages. Now, what do you think? Why do you think this is so?
I think basically like individual oral health awareness is a bit poor. Because I think the Philippine Dental Association is quite proactive with like the promotion, especially this February, which is Oral Health Month.
Yes.
So we have like programs, community programs that cater to children and even adults. I think the main problem recently is that when we were students, like maybe 12 years ago, we could do like dental missions, but now like students are not anymore allowed because I don't know, with like some restrictions. So it's like the promotion is there, but like the action is quite
Still
like
lacking.
yeah,
it's
lacking.
lacking.
Yeah.
Pero, Doc Tala, sometimes parents actually may consider it not as concerning kasi hindi pa nga permanent teeth.
Yeah.
But then, is that something that parents should change the mindset of?
Yeah, I think that's the most common misconception
Yes.
with baby teeth. So most of the people, even our lolas and lolas, would say, "Oh, that's just baby teeth.
Right.
It's gonna fall off anyway."
Yeah.
But the thing is, like, a lot of children are in pain, and that's what we don't really want because it actually translates to poor performance in school, like the difference in the behavior itself. Because like not all children could tell you that they're in pain or like they have
Yes.
pain in their
Yes.
teeth, and it translates differently in their performance daily.
Yeah.
So I think so this misconception really, actually there are a lot of like general health problems that is like rooting through the dental decay.
Yeah.
Ah, okay.
Like I'm sorry to like elaborate further, but
No, go
like
ahead. Yes.
some children like have like brain abscess because of just a dental decay. It can go up the brain. It could also block respiration, like the normal breathing.
Right.
Like you could see children with like asymmetric faces, like yung namamaga na
Yeah,
yung mukha. No, so that's just because of dental decay in the baby teeth. No, so remember that like baby teeth could stay in the mouth until they're 12 years old, and it erupts in the mouth as early as 2 years old. So that long of a time that you have to take care of it, if it starts decaying at an early age, then it would be detrimental to the child's health and performance at the same time.
Now, Doc, I'm curious, would you say that there's a lack of attention from government institutions in addressing these kinds of problems?
I think, so for the Philippine Dental Association, I think we're trying our best to promote.
Yeah.
But for like government institutions, maybe a little more help could is better. So I mean, if there's a budget for it, because
Right.
most of the time it's mostly like in our own, like for example, we like me and my friends would want to go on a dental mission, so we
Right.
or we collaborate with like some institutions to do this, but like. I think we could get more help from the government,
Yeah,
so
the
that
government
like
needs to do better.
I think with just dental education and like increasing of the awareness of people that oral health is also general health
Right.
is good for most Filipinos. Yeah.
Dr. Tala, do you think there is a direct link between the parents' socioeconomic status and their oral health habits?
Actually, if you look into studies, like basically this is a global study wherein like socioeconomic status really is directly correlated with poor, or like for example, if you're in a lower social economic status, you have a poorer health. This is because it all goes back to like, for example, because diet is a huge
Yeah.
like it's
Yes.
contributory to like the development of dental decay. So like for example, if you have a poor diet, then it also translates to like poor oral health.
Right.
Because like I remember like when I was like a dental student, of course we handle like kids from like a lower socioeconomic status. Like their parents would give them like instant coffee for breakfast.
Yeah.
Like
wow.
like
Oh,
like
wow.
Instant coffee sa kanin.
yes,
Yeah.
yes. They just
Sugar.
mix everything and
Yes.
it's all
Literally
sugar.
all
So
sugar.
sugar is really the enemy.
culprit.
The
Yeah,
culprit.
yeah.
So if you look into studies again, children below 2 years old shouldn't be really introduced sugar. But then in the Philippines, rice is life. We just like heard
Yeah.
about
Yes,
like
yes,
rice
yes.
previously, but actually like if you know like fruit sugar also is contributory because it's like
Yeah.
it's not a complex sugar. It just really destroys your teeth.
Yeah. So
Yeah.
kids, eat your veggies.
Yeah.
Always,
Sorry.
yes. And
Yes,
us too. We have to eat our veggies.
Yeah.
But Doc, I want to go back to what you said earlier, and I want you to expound because you mentioned that kids can get brain abscess from that, and I know rheumatic fever is also possible because like all the tooth decay can seep into the heart. So what other conditions can they get if they don't take care of their oral
So
health?
first is like they start off with a dental abscess, like nana,
Yeah.
within the mouth. No, and this is like parents would call me sometimes like my child is so much in pain, something like that, and then I'll tell them like to bring the child right away.
Right.
Because eventually, if the pain goes away, meaning the tooth is already dead. And then when the tooth is dead, that's when the
It's too late.
abscess, will
Yeah.
seep through the gums.
Yeah.
And then if it's not treated again, and if the immune system of the child is a bit low, then it would manifest. Remember, like infection thrives if the body is not
Yes.
healthy.
Yeah.
Yes.
So it comes out of like the face. That's what you call cellulitis.
Oh my gosh.
That's the inflammation of the face, like the spaces. And then if it goes down, it's called Ludwig's angina. It blocks the respiration. And that requires like a trip to the ER already.
Yeah.
Yeah.
Because they need IV antibiotics for
Yeah.
that. And then if it's untreated, it can go down the heart, cause bacterial endocarditis. Like especially if like for example you have patients with heart problems, it's very they need to have good oral health because again it could go down the heart.
Right.
Any infection above on the top jaw could go up the brain because there is no valves that like
Pang-release.
it doesn't really close. So like any infection here could go up the brain also. Yeah.
Well, Doc, the cameras did not catch it, pero pinavogue mo yung mga partners ko eh. Gumagano na sila. Like, they're checking everything. Baka-vogue sila. But, all joke. But when you look at what hit me there with what you said is that you encourage the parents to go see you once the toothache is there. But let's go lecture them. How often should they bring their kids to the dentist?
Actually, prevention is key to everything.
Yes.
So prevention is better than cure. So we'd like parents to bring their kids even if there's no pain. So as early as the child turns 1 year old or on the first birthday or once the very first tooth erupts, then the kid should be brought to the dentist just so that we could like lecture about like how they could take care of the teeth, etc. And then so that like for example if they're still bottle feeding, then we could like wean them off a little
Right.
with bottle feeding.
Yeah.
And then they just have to, actually, if there's nothing wrong, then we just see them every 6 months.
Okay,
every 6
that
months.
is great. You just gave me a new idea. Next time I'm a ninong somewhere, yung gift ko na lang dental, visit. Di ba? Pagka 1 year old
Great
nila.
gift idea.
Diba?
And people don't think that.
I'm a mom. I would appreciate that. I
yeah.
never
Doc
received
Tala.
anything like that, actually.
Dok Tala, meet my
Maybe I
inaanak.
should provide that.
Gift
certificate.
Yeah, actually.
Happy ba? Welcome to the Christian world. Here.
Please brush your teeth.
We were talking about that in the makeup room a while
Yeah.
ago, that bottle feeding as well,
Yes.
diba? Kasi maraming mothers, they after drinking the milk, they just leave it there.
Yes.
Diba? They don't rinse the mouth, so that also causes tooth decay. And we were talking about all the complications a while ago, and it all boils down to just really brushing your teeth
Yes.
regularly. Now, aside from bringing their kids to the dentist regularly, what can you advise the parents who are watching us? What are the easiest ways to just really prevent this from happening? Like, how many times should they change their toothbrush? What are the best oral healthcare products to use?
Yes, basically, they really just need to brush the teeth at least twice a day. So that's
Twice a
morning
day.
and night.
Okay.
Okay, and then of course, diet plays a big role. No, so like the ones with high sugar, like drinks, should be avoided as much as possible. Of course, eat your veggies. Eat your veggies, and flossing is flossing is a
And
bit,
for adults too.
Yeah, and adults,
And
of
adults.
course, yes.
Water
'Cause
flossing?
water flossing can be done, but also you need to develop their dexterity so that so they floss every time, because if you don't floss, you don't really clean 40% of your teeth.
Right.
Oh, that's
Because
crazy.
because decay could start in the middle of two teeth,
Yeah.
and then like that's usually like you don't really notice it
Yeah.
until it's too late, like until it gives you pain. If it gives you pain, then that's already near the nerve of the tooth, something like that. So basically, that's it. Diet plays a very important role. The changing of the toothbrush should be about, ADA says it's about 3 to 4 months because the bristles wear out. So it's not as effective as removing the plaque.
Yeah.
So you just have to change it every 3 to 4 months, also to prevent bacterial
Buildup.
buildup
Yeah, yes.
in your toothbrush. And then use a fluoridated toothpaste. Any toothpaste would do as long as it has fluoride.
Okay.
Because that's your first line of defense. Basically, the ones without fluoride, because we don't have fluoridated water in the Philippines. So it doesn't really like reinforce the calcium and phosphate that you have in your teeth. So fluoridated toothpaste is very, very important. And brushing supervision. You don't expect a child to brush on their own.
Right.
Yeah, so we usually advise parents to supervise their children until they're 12. Even if you think they're adults already, you have to like remind them, or like, brush in front of me, or like, okay, you brush first and then I'll brush after, something like that.
Sometimes you have to remind the adults pa to brush your teeth and floss. Oh my goodness. But thank you so much, Doc Tala.
Yeah.
We wish we had more time to ask you our questions. But if our viewers would like to get in touch with you for their dental checkup, where can they reach you?
Yes, they can reach me. So my clinic is just here nearby in New Manila in Domingo. They can search us in Dasi Dental, Dolatre-Turner Dental Clinic. So my parents are also dentists.
Aw.
So it's like a family business already.
Okay.
So like they could, we're open Mondays to Sundays, and then we also have online consultations. So we want to promote oral health, especially in children, as much as possible. So anytime they want to consult with me, then that's okay.
All
Perfect.
right.
fine, yeah.
Thank you.
Thank
Thank
you.
you so
Thank you.
much.
We're gonna wait for the baptism gift certificate.
Yeah, I know.
Yes, I'll prepare it for
That's
you.
going to be very helpful. But thank you so much once again, Dr.
Thank
Tala
you.
Dolatre-Turner.